Zoom. Okay, good evening, everyone. Welcome to our seminar of Mental Health Hers We Talk. As we all know, mental health is a very important factor of our well-being. It's become crucial during the pandemic as COVID-19 has changed our way of living, learning, and working. So as a journalist, I have covered a lot of stories recently about how people struggled mentally when isolated at home, as we are unable to talk and communicate with others. So we're very lucky today to have this informative online event, inviting three fantastic guest speakers from Ryerson University to discuss mental health issues, introducing some practical ways to deal with some common problems you might be facing. So they are Dr. Martin Antony, Dr. Alexandra Fiocco, and Dr. Candice Monson。那我现在简单的用这个国语讲一下哈。那欢迎大家参加我们今天这个 seminar。那我们今天这个 seminar 的名字呢叫做 Mental Health Hers We Talk。那我们都知道呢，其实这个心理健康对我们每个人都非常重要，尤其是在这个疫情期间呢，其实这个不同的生活方式、工作方式，让我们产生了很大的变化。那么作为一个这个新闻工作者呢，我最近也 cover 了很多这种有关人们有这个心理问题的一些故事，因为在这个疫情期间呢，我们没有办法像以前那样直接的面对面交流，所以今天我们就非常高兴请到了3位Ryerson 大学的这个心理健康教授，给我们谈一谈一些实用的方法。那我们刚才也介绍了一些他的名字。下面呢，我们就简单的介绍一下这个 seminar 的这个 organizer. So this event is one of a series of seminars organized by WeSupport, which is a non-profit community-based volunteer organization to provide mental health support for people affected by COVID-19. We will have an introduction later about this group. Other organizers of the event include the WCCYC, also known as the Wellness Counseling Center for Youth Canada, Ryerson University, the Memorial University of Newfoundland, and the University of Toronto. So after speeches, there is a Q&A session. If you have questions, do not forget to send them in chat room. 所以呢，我们这个今天的活动呢的这个组织方呢叫做 WeSupport， 那中文呢叫做加华心理健康互助群。那它呢主要是用来帮助在这个疫情期间，人们因为心理健康受到影响，起到一个互相支持帮助的作用。那么其他的这个organizer 还有 WCCYC， 还有 Ryerson 大学、纽芬兰纪念大学以及多伦多大学。那么在所有的这个教授的演讲之后呢，我们会有一个问答环节。如果您有什么样的问题呢，不要忘记把这些问题发到这个 chat room 里边，我们搜集起来之后呢，在这个 Q&A session 里边回答大家。那么 Dr. Lisha Yang from Ryerson University, also one of the main organizers, will introduce speakers before each speech and help summarize the content in Mandarin after. 所以呢，也是我们的主要的这个组织方，杨丽霞教授也是 Ryerson 大学的教授呢，他会在每一个这个教授的演讲之前呢，给大家介绍一下这个教授，之后呢，会给大家用这个中文来简单的概括一下这个教授讲的内容。那么现在呢，我们就有请杨教授先来开始。Now let's welcome Dr. Yang to introduce Dr. Martin Antony. Please.
Okay, thank you very much, Yangjie. So it's my great pleasure to be here today and to introduce our honored speakers. And they are my colleagues, my friends, and my mentors. They are psychologists from Ryerson University, and where I am honored to work. So so it's great pleasure to have them here and to have them here to share with us about their expertise in mental health and also how to cope during the COVID-19. The first speaker today is Dr. Martin Antony. He is a professor in clinical psychology at Ryerson University. He is a provincial clinical lead of the Ontario Structured Psychotherapy Program and also the president of the Association for Behavior and Cognitive Therapies. He has published numerous publications, including like 30 books and 250 journal articles and book chapters. He has been interviewed and featured more than 550 times in various online media outlets, including like a CBC and a National Post, New York Times. So it's really a pleasure to work with him. He joined the department 2 years after I did, but he inspired me in many ways, including how to overcome anxiety and when delivering a speech or teach. So without further ado, and please join me to welcome Dr. Antony. I will stop sharing so that Marty can share. Okay.
Okay, so now I will share my screen. There I go. Okay, great. Thanks very much. It's a pleasure to be here. So I'm going to be speaking about preventing and managing anxiety and low mood or depression during COVID-19. If anybody needs to get in touch with me, this is my website. It's martinantony.com. And my email information and other contact details are available there. So this is an outline of what I plan to speak about. I'm going to begin with an overview of COVID-19 and its impact on mental health. And then I'm going to be talking about 3 different approaches to dealing with anxiety and depression in the context of COVID-19 and also more generally. So there are many other strategies as well, but the 3 I'll be talking about briefly. One is strategies that involve changing negative thinking. Another one involves activity scheduling, and the third involves confronting feared situations. So I'm going to begin with a discussion of COVID-19 and mental health. So first, just a little bit about stress and the role of stress. Dr. Fiocco will be speaking more about stress, so I'm going to speak just very briefly about it. Stressful life events, just things going on in our lives that are stressful can make us more vulnerable to developing new psychological problems. They can also exacerbate psychological problems or make them worse. And when you think about COVID-19, there are all kinds of things about COVID-19 that are stressful. So one is that it's unpredictable. There's a lot of uncertainty. We don't know exactly, for a long time, we didn't even know what the effects of COVID-19 were, but we don't know exactly if we're going to get it or how we're going to get it. We don't know when it's going to go away. If we do get it, we don't know how severe it's going to be. It's uncontrollable. So we have no control or very little control over whether we get it and what the impact is of it. And not just a lack of control over the illness, but also a lack of control over the effects of the illness on the economy and on how we get around the city and those sorts of things. COVID-19 is causing financial stress for a lot of people. It makes it hard to eat the way we want to eat. It makes it hard to exercise. For some people, it's making it hard to sleep. It makes it hard to engage in the activities that we want to engage in. So if you miss traveling, for example, or eating in restaurants, or socializing with other people, those are things that are difficult to do now. There are potential threats to our health, and not just our health, but the health of our loved ones as well. Threats to our safety. So sadly, in some families where there's domestic violence, for example, it's a lot more difficult for people to get away from that than it might have been in the past. People are in close quarters and kind of stuck together. It can have an impact on relationships. When you're with close people day in and day out, it may lead to conflict in relationships or arguing or just stress in relationships. Many of us need small breaks from one another, and we may not get that during COVID-19. Constant exposure to the media. So the media, television and social media and newspapers speaking constantly about, the numbers, how many people have COVID-19 and what the impact is and so on. And then lastly, just minor day-to-day stresses. So again, going into a supermarket and maybe not feeling safe, or long lines to get into a supermarket, not being able to get certain products. So for many of us, not being able to find, early on, we couldn't find toilet paper or masks or hand sanitizer. So all of these things contribute to stress. And as we mentioned on the last slide, stress can contribute to feelings of anxiety or feelings of depression and other kinds of mental health problems that people may experience. So these are some examples of mental health problems that may be increasing during the COVID-19 period. One is low mood and depression, general worries that people may have about all sorts of different things, financial worries, so worries about money, worries about health, social anxiety. People may feel more nervous around other people, and contamination fears, worries about getting sick and touching things. These are just some data these are from studies in China early in the pandemic. About 16.5% of people were reporting moderate to severe levels of depression, which is much higher than we see in the general population. Almost a third of people were reporting moderate to severe levels of anxiety. 8% were reporting moderate to severe levels of general distress and psychological tension. The second study is a study of people who were self-isolating, people who were in quarantine for 14 days. They also reported elevated anxiety and stress, and this was related to poor sleep quality as well. So these are just some early data suggesting that, at least based on these surveys, that COVID-19 is having an effect on stress, anxiety, and depression. In terms of how do you recognize anxiety, these are a few features to look for. So when we're anxious, there are usually physical symptoms that we experience, things like racing heart and dizziness and sweating and shaking and breathlessness. There are also cognitive aspects. So the way we think changes. We tend to worry about things that might happen. We may believe things are dangerous. We may predict that, again, bad things are going to happen. We may interpret things in a negative way. We also change the way we pay attention to things. So when we're anxious, we tend to pay more attention to threat-related information. So if you're afraid of spiders, you might notice every dot on the wall, thinking that it might be a spider. Our memories are biased as well. We may focus on and remember things that are consistent with our fears. So if you're afraid of flying, you might remember stories about planes crashing, for example. We also tend to avoid things when we're anxious. So we avoid things that make us anxious. We avoid things that feel dangerous or threatening to us. So feared objects, feared situations. But people may also avoid things that mental, sort of internal experiences that they have. So they may avoid thinking about things that make them anxious, or they may avoid certain memories. They may also avoid certain physical sensations or emotions that frighten them. And then lastly, we also see safety behaviors. People do little things to protect themselves from becoming anxious, or to protect themselves from certain threats. If we're afraid of contamination, we may wash our hands, for example. We may avoid being around other people because we might get sick, for example. These are some features of depression that are common. So when we're feeling down and blue, we feel sad, we feel depressed. We also lose interest in a lot of things that we might otherwise enjoy. We may see changes in weight or appetite, changes in sleep. We may sleep more or less than usual. We may feel physically restless, enough that other people might notice our pacing, for example, or wringing our hands. We might also feel slowed down, where we're moving and talking a lot slower than what's normal for us. Feelings of worthlessness and guilt are very common when people are feeling depressed. Trouble concentrating, trouble making decisions. And then lastly, we may see suicidal thinking. And I just want to mention, though, that these feelings of sadness or depression, and as well as feelings of anxiety, can really range in intensity. So we all feel sad from time to time. We all feel scared or anxious or worried from time to time. At the other extreme, people may constantly feel very, very, very anxious and panicky, or they might feel very, very depressed, to the point where it's interfering with their life and causing problems for them. And again, we can see any kind of response in terms of severity, in terms of duration, anywhere between those two extremes. So how do we stay resilient and well during COVID-19? This is just a list of a few strategies that can be useful, and then I'm going to go into a little bit more detail about a few of them. The first thing that seems to be really important is staying engaged, staying active, doing things that you find engaging and interesting. And I'll talk more about that in a bit. Being aware of negative thoughts that may be influencing your emotions and challenging those thoughts, looking at evidence for those thoughts, learning strategies to think in a more balanced way, in a more flexible way, looking at things from different perspectives. So that seems to be important. A lot of times when people are afraid, as I mentioned earlier, they start to avoid things that frighten them. And a strategy for overcoming fear is to do the things that make you anxious. So we'll talk a bit about that as well. We also recommend, these are some things now that I won't have a chance to talk a lot about. One is limiting exposure to the media. So if you're finding that you're paying too much attention to the media, and again, this includes social media as well as traditional media, and it's affecting the way you feel, then that might be a sign to spend less time engaged in the media, and maybe engaging in the media in a way that's maybe less anxiety provoking. So focusing on sites, for example, that present things in a more balanced way. Focusing on relationships, making sure that you're maintaining strong relationships, being flexible with your partner or with your family members during these unusual times where everybody is under a lot of stress, for example. Mindfulness practice. So I won't talk much about that now, but Dr. Fiocco will be talking about that. And then maintaining healthy lifestyle habits, things like diet and exercise and sleep, minimizing drug and alcohol use, those sorts of things. And I believe Dr. Fiocco may also be talking about lifestyle habits as well. So I will not talk much about those. What I'd like to do now is to talk in a little bit more detail about challenging negative thinking. I want you to imagine for a moment that it's midnight and two neighbors have both heard a bang outside their homes. One neighbor feels scared while the other one feels angry. Now they've both heard the exact same noise and yet they're having different emotional responses. And my question to you is, why do you think they're feeling different emotions even though they both had the exact same experience? Now, normally, if you were here in my living room with me, I'd give you a chance to answer that question, but you're not here, so I'm going to answer it for you. And basically, the reason why these two individuals are both experiencing different emotions is that they're interpreting the situation differently. So you can imagine if you're lying in bed and you hear this loud noise, if your thought in that situation is, oh no, I wonder if my neighbor's okay. I wonder if something happened. Maybe my neighbor fell off a ladder. Maybe they're being robbed. Maybe something terrible has happened to them. Well, then you're going to feel anxious or frightened or worried. On the other hand, if your thought is, oh, my neighbor's making noise. I've been woken up. I'm never going to get back to sleep. I've got a big day tomorrow. I'm going to be exhausted. Then you're going to feel maybe irritated or frustrated or angry. So again, the way we interpret the situation affects how we feel in the situation. And understanding that is really key to being able to change the way we think and ultimately to change the way we feel in situations. So the idea is that we don't really respond to situations in our lives. What we respond to is our interpretation of those situations, our beliefs about those situations. So that's sort of one key piece of this from a cognitive perspective. Understanding emotions from a cognitive perspective requires sort of understanding how one thinks about situations. Our thoughts, our predictions, our assumptions, those are what determines how we feel in a given situation. A second piece, though, of cognitive ways of understanding emotion is the biases in attention and memory. So I mentioned this earlier. Again, we tend to pay attention to and we tend to remember things that are consistent with our emotions, and we tend to ignore information that is not consistent. So for example, if you're very shy or nervous around other people, you're worried about being judged by others, you might notice other people who are frowning around you or who seem their face is sort of uninterested. If you're giving a presentation, you might zoom in on those people that look bored. On the other hand, if you feel pretty good about your presentation, you may notice the people who seem engaged and seem to be enjoying the presentation. So again, we tend to focus on the things that are consistent with our beliefs. If you're worried about having COVID-19, you're going to focus on certain bodily sensations that are consistent with COVID-19. You might start focusing on your breathing, for example. And one thing we know is that when you're focused on your breathing starts to change. You may start to feel like you're not getting enough air, just from focusing on it as a result of feeling anxious. So the idea is that if you're looking for something, often you'll find it. So we also want to help people sort of work on changing that habit of paying attention only to information that's consistent with their beliefs. So these are just some steps for changing negative thinking, the thinking that contributes to anxiety and low mood. So the first thing is to identify the negative thoughts. So what is it that I'm feeling right now? So, what am I thinking right now? So for example, if you're feeling sad, that might be a result of social isolation, so feeling lonely. And what are some of the thoughts that go along with that? Well, there might be thoughts that you're alone and that other people don't care about you, or that some people, if they're feeling isolated and they're prone to depression, may feel that they're unloved, and that things are not going to get better, so they may feel hopeless about the future. So those are examples of some thoughts that can contribute to negative feelings. Step number 2 is to generate alternative perspectives. So just because I'm isolated right now at home doesn't mean that people don't care about me. It's possible that people do care about me. It's also possible that other people are preoccupied with their own situation right now, and are not able to reach out the way they might have been able to in the past. We also want to look at evidence supporting our negative thinking, as well as evidence that supports the alternative perspectives. So we try to come up with how do I know that my negative thought is true? What is, again, some of the proof that I have that that's true? Great question to ask yourself is, are there other ways of looking at this situation? So for example, if you're convinced that you're going to get sick and die from COVID-19, or that a loved one is going to get sick and die, we can look at the evidence for that. So although the virus is certainly a problem that we need to pay attention to, most people in Canada, the vast majority, have not become sick. Even the majority of people who get the virus don't become sick. That doesn't mean, or don't become very sick. That doesn't mean we don't need to pay attention to the virus, but it may mean that as long as you follow public health guidelines, that your personal risk is low. One of the things that I encourage people to do is to distinguish between their personal risk and the public health risk. So the way I look at the virus is similar to the way I look at vaccinations, for example. If nobody gets vaccinated, then we're going to have a problem. Diseases, all kinds of diseases will spread to the population much more than they do. On the other hand, if everybody gets vaccinated, then nobody will get sick from measles, for example. On the other hand, if I don't get vaccinated for measles, if I'm the only one, my risk is actually very low. So getting vaccinated for measles is not necessarily to protect myself. It's partly that, but it's also to contribute to the public protection in a way. So anyway, that's one way that I encourage people to think of personal risk versus public health risk. The last step here is to identify a more balanced way of looking at the situation. Again, to think of the situation in a more flexible way, to look at it from different perspectives rather than just that one anxious perspective or that one depressive perspective. A few other tips. These are unusual times, and the kind of high standards that we might hold for ourselves or for our relationships may not be very helpful during COVID-19. I think it's useful for people to give themselves permission to feel a wide range of emotions. You may feel sad and you may feel anxious in ways that you don't normally. You may feel more tired than you do normally. It's also important to recognize that some healthy behaviors may slip. You may not be exercising as often as you do at other times. It's also important to give yourself permission to be less productive if you're working from home, especially if you have children at home and other family members who are working from home. It's just, the reality is that it's just difficult to be as productive as you might be otherwise. This is a great book on changing negative thinking. It's called Mind Over Mood. It's probably one of the most popular books of its type out there. And it's also available in simplified Chinese as well. I've got the website there. It's hqedu.com/books/d127.html and there's a page where you can order the Chinese edition. Okay, I want to move on to the second type of strategy that I wanted to mention, and that's activity scheduling. This is an effective strategy for improving mood. If you're feeling down, if you're feeling isolated, if you're feeling sad, making sure that you stay engaged is very helpful. And it involves basically increasing activity levels or changing the balance between mastery activities and pleasure activities. A mastery activity is basically an activity that gives you a sense of accomplishment. So you feel like you've gotten something done. An example is finishing some task at work, writing a report, for example, or emptying the dishwasher. Nobody really looks forward to emptying the dishwasher, but when you've done it, it feels good. You know, you might think, I emptied the dishwasher. You might even brag about it. You might scream out to someone in your home, I just emptied the dishwasher. It just feels good to get it done. Pleasure activities, on the other hand, are activities that give you a sense of enjoyment. So these are things you do look forward to. So it might be going on a vacation or spending time with a good friend or something like that. They don't really give you a sense of accomplishment, but when you're doing it, you enjoy it. And most of us, we all need some balance of mastery and pleasure. If you're doing too much mastery, you might find that your mood starts to suffer. And if you're only doing pleasure, if you never feel like you're accomplishing anything, you might also start to feel empty or sad. So we all need some balance, although that balance is different for different people. When we withdraw from our active life, the idea is that we stop getting reinforced. So for example, if you think for a moment about what's the hardest day to drag yourselves into work, back when you were going into the office or wherever you worked. And for a lot of people, it's Monday. And it's even harder after a vacation. And that's because you're away from it for a while. When you actually do force yourself to go into work after a vacation, it actually usually ends up better than you think it's going to turn out. So you end up having a few positive experiences, and maybe someone says hi to you, or you have lunch with somebody, and it ends up going better than you think. The way energy works and the way sort of motivation works, it works more like a generator than a battery, in that you need to do something to generate the energy and to generate the motivation. So taking a rest and stopping doing things for extended periods will often make depression worse if somebody struggles with low mood. On the other hand, forcing yourself to do something despite that low mood will often generate the energy and interest and motivation that people are lacking. So what we encourage people to do if they're feeling down and they're starting to avoid things and not do things is to schedule each day on a diary. And you can use a diary like this. This is just one that I made up based on some others that are out there. And you can see that the day is scheduled from 7 a.m. to 11 p.m. And you kind of make a plan for what you're going to do each hour over the course of that day. And you rate how much mastery you experienced when you do it, how much pleasure you experienced, and generally what your mood was like. And by doing this, people learn, first of all, that their mood does vary depending on what they're doing. It goes up and down. And some things contribute to increases in mood, and other things contribute to decreases in mood. And over time, we try to encourage the person to engage in more things that contribute to better mood for them. The kinds of tasks that people may practice may just be tasks of daily living. It might just be going to the bank, for example, or washing the dishes, or phoning a friend, that kind of thing. It might be work or school-related tasks, social activities, pleasurable activities, just things that people like doing. These are examples of some social tasks that have been adapted for COVID-19. Taking a virtual class, cleaning and organizing your living space, cooking with somebody over a video call. So you're both cooking the same dish and you're connecting over FaceTime or Zoom or something like that. Using Zoom to connect with people just for social visits. socializing with family members while standing 2 meters apart, having a movie night at home, creating a virtual happy hour or a virtual coffee hour with somebody else, joining a virtual book club. So these are all examples of how you can adapt this for a situation with COVID-19 where there's just a lot of things that you want to do that you can't normally do. Some other suggestions for activity scheduling: start with manageable tasks. So if somebody's very, very depressed and they're barely getting out of bed, we might have them start by just getting out of bed and maybe making the bed and maybe taking a shower, those sorts of things. If you're already doing lots of things in your life, then we would start where you're at. If you're working way too much and not really spending any time on pleasurable activities, then we might actually decrease some of your mastery activities and increase pleasure, for example, to see if that helps with mood. We gradually expand the frequency and scope of activities as well over time, taking into account people's goals. So if somebody's goals are to increase social contact, we want to make sure that the activities that we're encouraging people to schedule are ones that increase social activity. And we also want to choose activities that are likely to turn out well, where the person's likely to get rewarded or reinforced for having tried that particular activity. This is a book. This one is not translated into Chinese, but it's a book specifically on overcoming depression through activity scheduling, or what we call behavioral activation. And it's called Overcoming Depression One Step at a Time. The last topic that I'd like to talk about is confronting fears. So one of the most powerful ways of overcoming any kind of fear is to engage in the scary activity until it isn't scary anymore. And you've probably all used this at some point. So for example, if you think about the first time that you worked at your current job, you might have been very, very anxious on that first day, and yet you're not really anxious anymore. If you think about the first time you went on a date with your partner, you might have been very nervous that first time, and yet you might not be anymore. Hopefully you're not anymore. You might have had fears of the dark when you were a child, or fears of dogs when you were a child that you outgrew. And why is that? Well, in most cases, it's because people do the thing that they're afraid of, and it gets easier. When people don't do what's afraid of them, what they fear, that fear tends to be maintained over time, or if anything, it may even get worse over time. And one reason for the reason why exposure can be such a powerful way of reducing fear is that you learn that whatever it is you're afraid of is not dangerous. Examples of exposure practices. I have an example here for somebody who's afraid of contamination. For people who are afraid of contamination, we might encourage them to touch things that they're afraid to touch. For somebody with a lot of social anxiety, people who are afraid of being judged by others, we might encourage them to engage in social activities until they're not afraid of those anymore. We also encourage people to reduce the use of safety behaviors. So for example, if they're afraid of contamination and they're touching things, we don't want them right afterwards to go and wash their hands to protect themselves. We want them to sit with that discomfort until it's not scary anymore. Now, during COVID-19, we've had to sort of adapt some of these treatments because some of the things we'd recommend to people are just not consistent with public health guidelines and safety. So where do we draw the line between a healthy coping strategy and an excessive, unhelpful safety behavior? And a few things to keep in mind. One is if you're dealing specifically with fears of contamination, we always want to err in the direction of following public health guidelines. So if the public health guidelines are telling you to stay 2 meters away and to wear a mask and to wash your hands frequently, then we would recommend doing that. On the other hand, we don't need to go beyond those public health guidelines. So for example, Toronto Public Health and other jurisdictions recommend washing for 20 seconds. That means that we don't need to wash for 5 minutes every time we wash. So we want people to, again, not necessarily go far beyond those public health guidelines. If you're not sure whether a behavior is excessive or whether avoidance is excessive during the pandemic, survey other people who you trust. So for example, find out how often other people who you think are responsible, how often are they washing during the pandemic, for example. And then consider the relative costs of the coping behavior, so the time and the energy whether it's preventing you from learning that the situation is safe versus the benefits, prevention of harm. And again, if you're not sure during the pandemic of whether a behavior is dangerous or not, I think right now it's always better to err in the direction of public health than danger if you're on the fence about a particular practice. So I just wanted to mention very briefly exposure as a strategy for dealing with fear. And again, this can be useful for fear of dogs, fear of heights, fear of socializing, a whole range of different things that people are afraid of. This is a book that talks about cognitive strategies as well as exposure, as well as mindfulness as well, a whole range of strategies for anxiety-related problems. This is a book that I co-authored. This is the new second edition that's coming out in January. There is a first edition that was published in 2009 with a slightly different title. It was called the Anti-Anxiety Workbook. But if you're not in a rush for it and you're interested in this book, the new second edition is coming out in January, and it's available now as a pre-order on Amazon or from the publisher. So I am going to stop there. Again, thank you very much. And I believe that Dr. Yang is going to provide a summary.
Thank you, Marty. And I can share my slide. Okay, so here we are. Okay, so 谢谢我们的 Marty 教授。那我来总结一下哈，我只有5分钟的时间，所以不会 cover 每一个 details， 我们就把他讲的这个要点给大家总结一下。Dr. Marty Antony 呢就讲的在疫情期间我们应该如何应对焦虑还有情绪低落这样的一个状况。那他主要提到了4点。第一点呢就是疫情和心理健康有一些关系。根据现在最新的这个研究呢，发现有的人，比如说最近的研究也表明，很多人呢汇报有一些焦虑的症状，有一些重度的抑郁的症状，还有通常所见的就是害怕，尤其是害怕这个感染呀，担心家人被感染呀，就是所有这些负性的情绪呢，都会在疫情期间呢有表现。那他也讲到了我们要提高我们的 resilience， 就是说我们在困难下，我们提高我们的心理复原力。他讲了一些步骤，还有一些 factor 可以帮助我们增加我们的抗压的能力。第二点呢，他讲到我们通常呢，我们有负向的情绪的时候呢，尤其是在我们中国文化里头，我觉得我们是不接纳这个负向的情绪。比如说我们有anger 呀，我们愤怒，我们伤心，我们难受，我们觉得恐惧、害怕、焦虑、抑郁，那我们觉得这个是不被接纳的。但是呢，这个他在讲的就是这些负性情绪其实是根据我们自己的想法和预期的一个假设有关系的。就是说同样的一件事情，不同的人去看，不同的人去解读，那他们就会引起截然不相反的或者不同的这个情绪反应。而同时呢，这些情绪反应呢，反过来呢，又会让我们对这件事情有这个根据我们这个情绪相符合的一些认识来去解读这件事情。所以他提到一些呢，就是说如果我们要改变我们的这个情绪，或者是想 manage 我们这些情绪管理的时候呢，我们就要尽快的切换这个角度，切换我们看问题的角度。那他讲的那4个步骤呢，比如说我们有一个不良的情绪哈，那我们就首先呢就要认识这样的情绪，认识这样的情绪以后呢，再看一下这个情绪的观点是什么样的，同时呢再想一想有没有其他的一个观点，然后再想想我们支持我们原来的那种焦虑的想法的有哪些证据，然后呢支持相反观点的有哪些证据，最后大家都列一下，其实发现其实这个事情不像我们想象的那么糟糕，这样的话呢就有助于我们发展一个比较 balance 的这样一个结论。还有他讲到这个战胜完美主义哈，我想我们很多的我们的中国人呢，我们有很多完美主义，我们做事情呢要强调完美。那他讲到了这个我们也要 overcome 这个完美主义，我们在家工作我们也不要求那么有效率，那么有高的产出，同时呢我们也允许自己有负性情绪，允许我们在行为中呢有一些做不好，这些都是可以接纳的。这样的话呢就是你的说到底就是你要接纳自己，允许自己犯错误， 也允许自己呢有不好的情绪。然后他讲了一个非常有效的就是活动的安排，我们要给自己来活动安排。那这总结一下呢，就是说你要量力而行，根据你自己的这个经历呀，然后量力而行，循序渐进。同时呢，达到一个小目标呢，你就可以给自己一点点的奖励。在选择活动的时候要注意呢，不仅要光是有它叫 mastery 跟 pleasure 哈，就是这个活动呢要不仅让你有成就感，同时呢让你觉得愉悦感。那这个呢，咱们不同的这个 generation 可能有不同的理解哈。你像我儿子这个，他们 young generation 的可能就是愉悦感就是为主导的，而我们上班的这些妈妈或者是爸爸们，这个我们可能就更注重 mastery 是吧？那我这个时候其实他讲的很好的一点就是我们这两个我们都要考虑，不能说是光是追求这个 accomplishment， 同牺牲你的愉悦感，这样的话你就会 over coping。所以呢，我们在选择的活动的时候要有选择，注重自己的短期和长期的目标，看看它是不是行之有效的，在我们现有的条件下是不是可行的。还有就是能量是哪里来的？他不建议大家说是什么都不做，然后你就等着，这个焦虑不会自动就消失。说我们伤心了，那我们就不做了，安静休息。很多的时候我们给别人建议，其实他觉得这个不是一个有效的方法。你越不做事情，越空白，那么其实就更助长你的这个抑郁的情绪低落的这个状态。那其实有的时候我们的 energy 是来自于我们自发的，我们参加一些活动，从活动中获得了一个成就感，那我们就更愿意去比较积极的投入。那所以我们要做这个发电机，而不是一个电池，电池就是耗完就没了。发电机呢，其实你是通过活动可以自己 generate energy 的。最后呢，就是我们怎么样克服这个恐惧和害怕的这种焦虑。那后面呢 Dr. Monson 呢，他也会提到这样的一个心理学的一些治疗的方法。他其实害怕呢，你越害怕越避免，其实就越害怕。他提到的一些你要暴露疗法或者脱敏疗法，就是说你要逐渐的就接触这个害怕的环境或者刺激。比如说我们担心我们不洗手可能就会被感染呀，那么我们就尝试去有的时候呢，我们就感觉我们那天我们出去散步了，回来以后也没洗手，最后也没啥事儿，其实这个焦虑的水平就慢慢的下降了。那我们要 draw a line， 要 keep a balance， 就是在我们怎么样是积极健康的应对，同时呢要避免过度反应，就是过度紧张，天天我们就不管在哪里，在家里都 wear mask， 这个就有点过度了。就是说我们要有一个健康的应对，保持这样一个心态，可能就会避免焦虑。其实过度的反应呢，其实反而是让人焦虑担心的。那这就是主要的一些要点。好的，那下面呢，我们就来